All right, so we are going to go for a walk, and today we're going to be walking in my backyard, and it's a beautiful, beautiful Florida day. So where I walk really is completely dependent on the time of day it is. You saw all the wooded areas out there, so sometimes when I'm walking, it's really early in the morning or later in the evening, and the wooded area is not necessarily the safest place. So, even though this is a nice neighborhood, there's a hospital right across. I'll show you if you can see it in the back. Let's see. There's the hospital, and it actually happens to be where I was born. So, sometimes, people in all different stages visit the hospital and end up in the woods over there. So, let me share my shoes with you too. These are these not the cutest? So, these came from Brooks.com, and originally I was going to get them at Dick's Sporting Goods. However, Dick's was sold out of them, so I got them from Brooks. And so this channel, this is actually going to be my second channel. I have a main channel, and it is called The Most Crafty Nurse. And I really do all crafts and stuff like that on there. And it's a fun channel. If you like crafts, consider going over to visit. But, I wanted to do other stuff. I am 51. I'll be 52 next month. I've done a lot of things in my life. I've been extremely blessed with experiences. I am a nurse. I have been in the emergency department for about 25 years. The last 10 or so years, I've been a nurse leader. And I've had a lot of experiences. I grew up in a lower middle class family here in Florida, and the things I've done in life are just really because of my own ambition. Life could have gone either way, to be fair. I mean, I have a great family. We're very close. I love them dearly, but we definitely didn't grow up with a lot of money. We had to, all make our own way. So, and so the reason for the name for this channel is I have 2 grandkids. I love them so much, and I am fun, and I think I am pretty fabulous. At least they think I'm fabulous. And Gaga, well, so, everybody talks about making these, super cute grandma names and all of this stuff. Well, I was going to just be grandma. Like, I had no need to do anything else. I was going to just be grandma. And I always call myself grandma. And then my grandson, the oldest one, he's almost 2. He'll be 2 next month. And he and I are exactly 50 years apart. I love it so much. But one day he started calling me Gaga instead of grandma. And when I would call myself grandma, he would say, no, Gaga. So I am now Gaga. So if we put lady in front of that, maybe I'd never have to work. But not the case. All right. So anyways, let's talk about thyroid disease. And let's talk about it from not only a nursing perspective, but just a personal perspective. So I know a lot of people are going through issues with their thyroid and, thyroid health. And, there's so many things out there about, how to fix your thyroid and, whatever. I mean, most of which honestly just don't work. So I have a combination. I have Graves' disease and I have Hashimoto's. So what I think has happened, my life has kind of gone in 2 stages with the thyroid disease. So I started out with the Graves' disease being what was prevalent. However, I don't have Graves' disease super bad. And I never got the bulging eyeballs. I never had the look, except I was extremely thin. I had a really high metabolism. So when I was young, I could eat anything I wanted and still never be over 100 pounds. And then after I had my daughter, that sort of started changing. Not initially, not the first few years, but after, it was slowly changing, right? It was harder for me to lose weight. It was harder for me to keep it off. I definitely couldn't eat anything I wanted anymore. But then as I just started getting a little bit older, about 30, weight started creeping up on me. And one day, it was out of the blue. And I know people say it, and if it's happened to you, listen, I get it. It's happened to me too, because a lot of times people don't believe it. But out of the blue, one day, I went from wearing one size of clothes to not being able to pull those clothes up past my knees. And honestly, I just thought, well, I'm getting older and that's the way it is. And I was never one for doing a lot of dieting. And because I had always just naturally been, pretty thin, dieting wasn't really my thing. So where I used to be 100 to 110, well, now suddenly I was staying between 150 and 160, and that was my norm. So I just carried on with it, and I would have periods where all of a sudden, for no reason, I would lose a bunch of weight. So I think that my body was just sort of fighting back and forth between the Graves' disease and Hashimoto's. And then at about 40, that stopped. I just stayed 150 to 160, and I'm 5'3". So it was what it was. I got remarried, life was happening, and about that time I was starting to work in leadership, and I was just really, really busy. I was working on my master's degree. My daughter had gone off to college, and I was 44, 45, and I really, some days, sorry, my back itches. All right. There were some days that at work, I would have to take a nap in my office just to drive home. I would get home and then I would just fall asleep. And I really thought that it was because I was working so hard at work and working on my master's and I just had all of these things going on, right? Well, that went on for a while, and then I just really started feeling so bad. So bad. And one day I was at work and I really thought I was having a stroke. Like my arms and legs were feeling like numb and tingly. And the funny thing is, for years, I had problems with like heart palpitations. My heart would go into weird rhythms. And the funny thing is, no one ever checked my thyroid level, ever. And even as a nurse, I didn't really think about it, to be honest. If it were somebody else around me, I would have immediately thought about it, but not for myself. So I was feeling really bad, and I ended up being seen in my emergency department that I worked. And they did ultrasounds. They thought maybe it was my gallbladder, because I was having these weird, spasm pains up near my chest, and I knew it wasn't my gallbladder. I knew it was something else. So then, I had asked the nurse. I was like, I know the doc didn't order it, but he won't care. Will you just add on a TSH just for shits and giggles, So my TSH came back at 189, which is horrible, intensely horrible. So if you're going through thyroid disease and you know that, really you want it to be under 4, and your TSH, so that's your thyroid stimulating hormone, and more of it is actually worse than less of it. Okay, so if you're hypothyroid, your TSH is high because it's how much it takes in order to stimulate your thyroid to work, right? So if it takes more and more and more, it's really bad. And then if you are hyperthyroid, then it's really low because it doesn't take much at all to stimulate your thyroid. So mine was 189, which is intensely bad, not good at all. And the doctor said probably the reason that I tolerated it as well as I did and for so long, it had probably just been going on for such a long time, because thyroid disease is very slow growing. It's not something that acutely, quickly happens. It's very, it's a slow disease process. So they said I probably, tolerated it, for so long because it had just been, coming on so slowly. So I went to an endocrinologist, and, even though I'm a nurse, I'm not immune from the whole push and pull of doctors and, the this and the that, and trying to get answers and trying to figure out. And it was a very, hard time, right? So we did the cancer numbers, and they were really high. The Hashimoto's and the Graves. Hashimoto's was super, super, super high. So I had that quite significantly, which accounted for, so my hair was falling out. I used to have really long hair, and I had to cut it short because my hair was falling out. I would get these weird, horrible cramps all the time. Weird, horrible cramps all the time. And aside from the weight gain, and my skin was so dry, like sometimes it was so dry that it hurt. So, and I was so tired. I felt fuzzy. My brain felt fuzzy, and I just felt off. And for a long time, I really just felt off. So, I did have a nodule on my thyroid, but the other thing is my thyroid, I didn't have a goiter. So a lot of people with thyroid disease, you get a goiter and your neck, gets big. And when you palpate the thyroid, it's rather large. Well, when mine was palpated, it wasn't palpated to be large. And I think that's why no one ever thought to, link anything to thyroid disease, right? So, and my thought with that is just know that everybody's different. Just because textbook is one way doesn't necessarily mean that everybody's going to be that way, right? So it was a really long journey and struggle of trying to figure out what was going on. I had an ultrasound, which I had a nodule, and the way that nodule was, it was, most likely cancerous. The good thing is with thyroid cancer, there's not a good thing with any cancer whatsoever, but it is very slow growing. So a lot of times you do catch it before it does, a lot of damage, depending on the type. There is a type of thyroid cancer that's very aggressive, but the one that most people has is a slow growing cancer, which on the other hand of it is sort of sucky too, because people will say, well, at least if you have cancer, at least you have the good cancer. Excuse me? I'm sorry. There is no good cancer. There is no good cancer whatsoever. And regardless of what kind of cancer diagnosis you get, it is earth-shattering to find out you have cancer. And I would get so angry. And the endocrinologist would say, well, at least you have the good kind of cancer. No, at least would be if I had no kind of cancer. Thank you very much. So, if you're going through that struggle, I get it, because people just don't get it. They don't get it. And one of the big problems with thyroid disease is that it makes you feel so bad and so terrible. Oh, that dog just scared me. I don't know if you could tell. It was just a little chihuahua, and I kid you not, I just threw the phone. Fortunately, I caught it, but I did throw the phone. So, anyways, if you're going through that, please know that you are not alone. I think most of us that go through thyroid disease have to feel that. And, unfortunately, because it doesn't leave outward scars, a lot of times, people just don't realize. They don't realize how hard it is and how it makes you feel, right? So I had just a lot of struggle, trying to figure it out. And as my numbers would start to go down, my endocrinologist would tell me, oh, you should be feeling better. But no, I don't. I didn't feel any different. I didn't feel any better. And what I realize now is the fact is you still have Hashimoto's. You still have Hashimoto's. And I felt like he really didn't listen to me. And I felt like I wasn't being heard, or how horrible I felt wasn't being taken serious, because they would say, oh, look, your numbers are getting better. Well, first of all, my numbers never got super better. The lowest it got to was 54, which still, if you were diagnosed with 54 as your TSH, they would still be like, oh, that's terrible. But because mine started so high, 54 seemed like nothing to him, And it took a really long time to get down to 54. So I was going to have a biopsy on my thyroid because of the cancerous nodule. Well, I got very fortunate because my daughter she's a scientist, she's a researcher, and at the time she worked in robotic surgery, and she was young. She was only like 22 at the time, but her chief medical officer of her program happened to be a otolaryngologist, and he was the chief of head and neck surgery. So she was talking to him, and he told her, he said, I've seen so many people go through this where, the endocrinologist just pulls them back and forth for so long, trying to get this level, that level, whatever. He said, I'm telling you, she's not going to feel better as bad as hers is, because, I was severe. It wasn't a little bit, having a TSH of 10 makes you feel horrible. So you can imagine 189, right? Or even down to 54, which is what it was when it came out. And he was really hard to get in with because he is incredible surgeon. So I got very fortunate because of their working relationship. I got in to see him, and we talked about it, and I decided to have it taken out. Instead of doing a biopsy and going through 2 procedures, I opted to have my thyroid removed. So when it was taken out, yes, it was cancerous. Of course they, biopsy the materials after they come out. Yes, it was cancerous. But also, like, my thyroid was so toxic. It was so toxic. And it had shriveled up. So the reason why it was never able to be palpated as a large thyroid is because it shrank. It actually shriveled up. He said that my thyroid was as small as an infant's thyroid. And it was so toxic that my body built a sheath around it. So there was a thin membranous layer covering around my thyroid that my body produced in order to protect me from my thyroid. So I got so fortunate. So I had it out. I was extremely scared. So if any of you guys are getting ready to go through that, I completely understand, because it is really scary. It is a scary thought, because you're basically having your throat slit open, right? Your throat is being cut open, and they're taking away an organ that is essential for life. Like, you have to have a thyroid in order to function. Your thyroid controls your entire metabolism and so much functioning of life. And then your parathyroids are right there attached in that area, and they control your calcium absorption. And, calcium, we think about it for our bones, but it's also essential for muscles, including the heart muscle. So we had already planned on, if something happened that he would have to remove my parathyroids, he'd be putting them in my forearm and, letting them work from there. So we had all of that planned, but I was so nervous. And, being a nurse, I was extremely nervous about going under anesthesia. And I will tell you, I had an anesthesiologist, was female, who happened to also have had her thyroid out, and she was a godsend. And this is a reminder for everybody, whether you're in healthcare or whether you're not. The things that you say to people mean so much, and they're so important, and words really do matter. But she came in and she said, I know you're a nurse, so, for me, being in the job that I do, when I had mine out, I know that my biggest concern was having to be intubated and someone else control my oxygen. And she said, I can imagine that's probably a challenge you're having right now. And I said, yes, that was my big fear. And she said to me, well, you don't have to worry. You are in really great hands, and I'm going to take good care of you. And I believed her. I trusted her, and she was amazing. And at that moment, my fear's gone. My fear is gone, yep. And so I went through my surgery, and the doctor did an incredible job. My parathyroids were fine. I didn't even have to have any drains, and I was able to go home that night. So that was fantastic. So if you're having this, these are some of the things I want you to know. It didn't hurt. I had no pain afterwards. Zero. None. No pain. My throat was a little sore eating because of being intubated, and that lasted a couple days, but no surgical pain at all. And immediately, I am not even joking to you, immediately, I felt like a new person. Within a week, I was like, I did not know you could feel this good. I didn't realize how bad I actually felt until I felt good. So I felt like a new person. And it was incredible because my thyroid levels, I went immediately back on my Thyroid, which I don't do the levothyroxine. I can't do the generic. It just doesn't seem to work the same for me. I do actual Thyroid. But within a month, my TSH was at 0.94. And now it went up and down for a little bit, and I still occasionally have times where I can tell I'll put on weight, and I'll call my doctor, get my labs checked, and we'll have to change it. But the first couple years I was having to get a lot of blood drawn, do a lot of changes, and then it just started staying pretty good. And I occasionally have to have it changed. I'm now at a spot where I get my blood checked every year unless I'm having problems and I feel like I need to change it more often. But for the most part, it's once a year. And I feel good. I think the important thing is, staying active, taking your medication as you should. And the other thing that I found that really, really affects me a lot with my thyroid being gone is sugar. So I can tell when I'm eating too much sugar. It definitely makes a difference for me. So I try to stay on a lower sugar diet, and I make sure I exercise. Even if it's just walking, I try and do it. I like to do it every day, but I always do it most days. There are some days that, for whatever reason, it just doesn't happen. But I will tell you, it has been such a journey, and it'll be a journey for life because I will forever be without a thyroid. I still have Hashimoto's. The symptoms, though, after having my thyroid out, the symptoms are very minimal. Like, it's incredible the night and day difference for me. I will always have to have Thyroid. And, so I'll always be at the mercy of taking that medication. But that's okay because I feel good. There was no cancer outside of any of the margins of my thyroid. And I'm good. So if this is a struggle that you're going through, know that you're not alone, and there is definitely help on the horizon. You can feel good. You just have to be an advocate for yourself. All right. Hey, listen, I hope you guys have a super blessed and beautiful day. Hit the subscribe button, and I'll see you later. We'll take lots of walks together. All right. Bye, friends.